An acute assessment unit is there to provide some specialist assessment for patients referred in by other members of the healthcare team, be it GP or paramedics. And essentially it's a specialist service that provides some rapid diagnostics, rapid assessment to hopefully make a very early decision about what might be wrong with the patient, what needs to be done about it, whether that can be done at home or in a different setting, or whether they might need to stay in hospital for some further treatment. I think the environments are really important in terms of the assessments you do, and having a range of different environments allows you to have some flexibility in what you do. I think areas where you can have seats for patients to wait in, some consult rooms where you can see patients in a more outpatient style environment, even if they're in an emergency admission, a range of trolleyed areas that you can use for more rapid assessments, and a range of bedded areas for patients who are a bit more dependent, need a bit more care. I think the other element of it is having some flexibility that you might on different days need different amounts of different environments, and try and have that flexibility to really adapt to what's needed on that particular day. I think the workforce in your assessment unit is key, and really it's the capacity your unit has to deal with the patients. So a key point of that is matching the amount of workforce you have to the demand that you need to meet, and having a range of workforce available. So nurses, nurse practitioners, physicians associates, and a range of medical staff as well, that are flexible, can work in different ways at different times to meet that demand. I think some of the key relationships, both from patients being referred in, so relationships with your GP, with your A&E department, with your urgent care sector, so they understand the service you offer and alternatives that might be available. And there's some key relationships inside the service, both in terms of support services with pharmacy, radiology, pathology, and also the specialty team, so that you can always access what that patient needs, when the patient needs it, as rapidly as possible.
In my role as General Manager for Emergency Care, it's vitally important that I have a close working relationship with the clinicians leading the service, and that we're able to understand the capacity and demand within the unit. We do this through having a status at a glance and being able to understand the quality indicators of the unit. Some of these include time to initial assessment and treatment and time to consult and review. We also need to understand the length of stay within the unit and ensure that we've got good patient flow throughout the hospital. So my top tip for an acute assessment unit is to ensure that you've got good leadership and strong relationships with your key stakeholders.
So my top tips for acute assessment unit are excellent communication between all areas and early discharge within the acute assessment unit and wards.
So top tips for running an assessment unit would be, I think, keep it simple, keep it patient focused, try and avoid unnecessary delays wherever you can, keep your workforce engaged, both back of house workforce as well as front of house workforce. Manage the integration with other services as actively as you can, make sure they're on board with things. And above all, keep it about the patient, keep it focused on the individual patient.